Leading eye surgeon Dr. David Price discusses the first and only FDA-approved treatment for dry macular degeneration.
The new procedure is called photobiomodulation, and what it treats is the retina. And the macula is what's degenerating, and what photobiomodulation does is it stimulates the mitochondria in our cells to help reverse or at least slow some of those changes depending on the person. And I think what's really exciting about this treatment is that there's some hope for slowing progression of dry macular degeneration. I mean, historically, it's been one of the leading causes of vision loss, leading cause of legal blindness in patients over 65. And so when we think about that, to have some hope now for slowing that progression, reversing the progression, preventing people from going blind, it is really exciting to be part of that. So there's two versions of macular degeneration. There's a dry version, which everyone starts out with, and then about 10% of people will convert to the wet. And so in the dry version, which is 90% of people, it's kind of the slow atrophy. So with dry macular degeneration, it's going to slowly progress, generally over 2 to 10 years, but eventually you tend to lose vision. It's one of the leading causes of blindness, and actually at age 65 and over, it is the leading cause of central blindness. So once you lose vision from dry macular degeneration, you can't get it back. I think when we think of this in the treatment of dry macular degeneration, I'd say in some regards it's a significant breakthrough, but it's definitely a significant improvement. It's the first treatment that's approved for dry macular degeneration in the United States. Additionally, if you look at the study data that was used to approve it by the FDA, it cut the occurrence of geographic atrophy by over 2/3 versus the control group over a 2-year period. And so, I mean, if you think about, you're taking your risk of permanent vision loss or probably legal blindness down by less than to 1/3 of what it was before, I'd say that's a pretty big breakthrough. So in terms of pain, it's not painful at all. It's just a light that's shining on your eye. Some patients say they feel warm, but that's really about it. In terms of risk, there weren't any risk identified in the light sight trial to get this approved, so in hundreds of patients. Controlling for patient characteristics, they found no increase in the risk for conversion to wet, which was a big deal because some of the early injections for dry macular degeneration actually increased your risk for wet macular degeneration. And so from that perspective, this is huge because it doesn't increase your risk for that. There is no injections with this treatment. It's all light-based. There's no pain. The studies and hundreds of patients didn't identify any adverse events. I think if you know you have a history of dry macular degeneration, then I think it's definitely a good idea to come in and get treated. Dry macular degeneration is the leading cause of vision loss in people over 65, and so this treatment can reduce that significantly, that percentage chance significantly. So the sooner that you get diagnosed, the sooner that you start treatment, the sooner progression can be slowed. And so if you slow the progression sooner, you're a lot better than if you try to slow the progression, right before you get to atrophy. In the sense that it's probably a lot easier to stop a moving train early.
If you've been diagnosed with dry macular degeneration, call Price Vision Group today to see if you qualify for this breakthrough treatment.